All right, let's bring in former CDC Director Dr. Robert Redfield. Sir, thanks for joining us this afternoon. I wanted to ask you off the bat about President Biden, but following on Hillary's reporting, I got to ask you why the United States is lagging so far behind, especially Western European countries, when it comes to testing. Why aren't tests now, widely and cheaply available to Americans?
That's a really important question and a really important situation that has to be corrected. I mean, we're 2 years into this, and I think one of the challenges is people talked a lot about how many tests we're doing, but I don't think people sat back and said, how many tests do we need? I've said that I do think I'm glad to see the president's going to encourage more testing with half a billion tests that he's talking about bringing online, and I heard Dr. Fauci say per month. But I estimate that this nation probably needs on the order of 1 billion tests per month in order for us to have the testing we need. Testing is not just a clinical tool, but really testing is one of the most important public health tools we have right now. That is regular, repetitive testing of people at risk for infection so that we can identify the silent, asymptomatic infected individual and pull them out of the transmission pool. And we've not applied that tool effectively to date.
Dr. Redfield, there's a great deal of emphasis on the surge in cases, but is that really the appropriate metric when a lot of people have 2 shots in them, some have 3? Should we be looking at some other metric like perhaps ICU cases or fatalities?
Well, Michael, it's very important. There's 2 different issues. Obviously, one as an infectious disease physician is to try to control the pandemic and infection. But the consequences of infection, which are so significant to us, are just what you said, hospitalizations and death. And clearly, the threat that we had at the beginning of the pandemic when New York City's hospitals were really going under and we had to put emergency teams and even some of our military ships up there to take care of patients, clearly the current stress on our health system is real. Obviously, you've heard the president's going to announce some more surge teams to go out to help with it. And that is really the critical issue, that you can get enough increase in our hospitalizations that are pushed up by COVID that it makes the overall hospital system not function effectively. And there are a number of hospitals right now that are in what we call stressed situations that may have to go into crisis care. So that really is the big issue, is hospitalizations and deaths. But, controlling infections is also important because you never know where that person who gets infected is going to then pass on that infection to. You don't know which vulnerable individual may be the next in line.
So we're going to hear, Dr. Redfield, from the president directly. I mean, they're going to make this announcement from the White House any minute now. What do you think is the most important thing for the president to say? What would you most like to hear from him today?
Well, Julian, I think there's really 4 things that I think are important for him to do. One is, and he'll do this, I'm sure, is to reemphasize the American public that vaccines do work. And it's really important that each of us take the responsibility to get vaccinated and to maintain our vaccine status, and that we're likely to require not only a 3rd shot, but I anticipate with Omicron that we're going to need to have potentially a 4th shot. I would prefer the president not to put blame on the unvaccinated. As a physician, I know I've had challenges over my medical career as an internist in motivating patients to take care of themselves, not to smoke, to basically control their diabetes, to exercise. And I think the way to do that is to enter in an effective dialogue with them as opposed to sort of blaming them for the medical conditions that they suffer. So I hope he's going to try to really ask the American public to do their job to help those of us that haven't been vaccinated, to encourage us to get vaccinated as opposed to pass blame. Secondly, it's really to expand testing. And I think we have to realize that testing is one of the most critical public health tools that we have. Regular, repetitive, once or twice a week testing into people that are at high risk for infection. I particularly think in our schools, K through 12, we should be testing kids, to once or twice a week and removing the infected person, and approach that as our strategy of identifying knowledge of infection rather than these generic strategies. Let's just assume everybody's infected. Let's assume everybody has to do this. No, let's go down and use the tools we have and diagnose. And the 3rd thing, of course, I believe...
Doctor, sorry to interrupt you. I just want to pick up on a point that was important a moment ago. You said you think that the Omicron variant is going to require a 4th shot, a booster shot of some kind further down the road? Talk to us about that. That seems like news to me.
Well, I think, yeah, Julianne, I think the reason, if you take blood from a vaccinated individual like myself, and you ask that blood to neutralize, the Omicron variant, it's now about 40 to 50 times less able than it could from the previous variant that we just had. So in other words, the power of each neutralizing antibody is highly diminished. And so while we came and said we needed to boost at around 6 months is what the general consensus was in a population for the previous variant, it's very likely in my mind that the Omicron variant is going to, the vaccine is going to lose its power quicker than it did from the previous variant. So it may lose its power in 4 months or 3 months. And I think we should be ahead of this curve, not behind it. I think we were very late in recommending boosters as a nation. I know we pushed on for them much earlier in our nursing homes in Maryland, but I think we should be ahead of this. We don't need to wait until we prove that the vaccine is no longer working in hundreds of thousands of people. And I would guess that because of the weakness, the relative weakness of the vaccine antibodies against this virus being, as I said, about 40 to 50 times less potent, I anticipate that particularly the vulnerable and elderly are going to need to be boosted earlier, probably closer to 3-4 months than 6 months in the future. But we'll see what the data holds, and I think we need to be aggressive in obtaining that data.
Dr. Redfield, a lot of folks reacting to the headlines feel like, oh no, here we go again. It feels like March 2020, but let's give them some good news here. We're far beyond March 2020. A lot of people have gotten vaccines. You've learned a lot more about the disease, right? I mean, isn't there cause for hope? Even this may be a difficult time, but we're in a much better place than we were a year and a half ago, right?
Yeah, absolutely, Michael. I think that should be hopefully the message. This is not a message of a winter of death. I think this is a message of that we're going to begin to get back into life as it was in a safe and responsible way. And we have tools. One tool, the third point I was going to make, was the third tool. It's so important for the president to push, like we did for, say, Operation Warp Speed for vaccines, is we really need to accelerate the private-public partnerships to develop antivirals, to redo the monoclonal antibodies that are no longer effective, get many more antivirals out there. We've seen the Merck and the Pfizer with the first ones, but the private sector is really prepared. This virus is very susceptible to targeted drug development, and we need to make that up. It's the same priority that we saw in the Trump administration to get vaccines out in 7 months. We need to get antivirals out now over the next 12 months and put a real push on it. And that will change the lay of the land. Once we've got a virus that's now less likely to put most people in the hospital, but we also now have medicine that you can take that actually is highly effective in either preventing you from getting infected in the first place, or if you get infected, keeping you from getting sick enough to feel symptomatic or have to go to the hospital. I think this is, the power of science is enormous here. And I think we should be very optimistic. But it is going to take, I think, a very important concentrated effort to get a private-public partnership to accelerate the development of these antivirals.
The antivirals, yeah. Sir, the Biden administration is following CDC guidance here, which says that you can get a booster shot. You're eligible if you had your second vaccine shot, in 6 months or longer ago, right? But we now know that in Europe, a lot of countries, folks are getting booster shots in just as little as 3 months. So if the president's priority here is getting everybody the maximum amount possible, why aren't we loosening the guidelines, whatever you want to call it, decreasing that timeline here and allowing Americans to get a booster within 3 months? There's something like 55 million Americans who had their second shot less than 6 months ago, but maybe they would go tomorrow and get the booster if they could.
Yeah, Jillian, I agree with you. I think particularly now that we have the Omicron variant, there should not be rigidness about this. Hey, you're 5 months, you need to wait. No, I think we should basically really encourage people to get that booster injection. I've told you my prediction is that the Omicron variant's going to require earlier boosters than in the Delta variant. And we should be moving in that direction. I mean, there's two approaches that public health takes. There's the one that basically tells you what you saw, In other words, it has to wait to see it to tell you what you saw and then do something about it. And the other approach is to use knowledge that we have to be able to see what's coming and try to intervene. I'm going to argue that I see what's coming, that these vaccines are going to last less long. You're going to wane quicker. We should be leaning towards earlier third injections and potentially eventually fourth injections, particularly for the highly vulnerable, the people in our nursing homes, people with significant comorbidities. I think it's sad when you see these people sort of want to go get vaccinated and they're told you got to wait another 6 weeks.
Right.
Because the reality is some of those people in those 6 weeks potentially could have a significant negative consequence.
Dr. Robert Redfield, former CDC Director, thank you so much for your service on behalf of public health, and thanks for your time today.
Thank you, guys. Thank you very much.